If you're watching this video, you're probably thinking, I'm young, healthy, and I always get a clean bill of health when I visit my doctors. So why do I need health insurance again? And can't I just go without it while I'm starting off my business and I'm not making a lot of money? Well, you can, but it wouldn't be smart because going without it can actually cost you more money than if you had it. And that's just one reason why. In this video, we're going to discuss 4 reasons why you shouldn't skip on health insurance just because you're healthy. Hey, I'm Shamy. I'm a healthcare finance consultant, and this channel is all about helping you understand your health insurance to save money. So if that's something you're interested in, please subscribe down below. The first reason you shouldn't skip on health insurance just because you're healthy is because of lower prices. Medical services usually cost less with health insurance, and that's because health insurance companies negotiate lower rates than doctors and hospitals would otherwise charge. And that's all because of one word: leverage. Now, you have this when you're a member of a health insurance company, but not when you're on your own. And here's how it works. Hospitals want leverage because running a hospital is incredibly expensive. They have enormous fixed costs like building maintenance, staff to pay, and expensive technology, regardless of the volume of patients to cover those costs. So to cover them, they negotiate higher reimbursement rates with health insurance companies. And the more dominant a hospital system is in a region, the more it can demand because there are a lot more people in that area who demand on that hospital for care. Well, insurance companies also want leverage so that they don't have to pay the high costs that the hospitals are demanding. If prices are left unchecked and they rise, premiums rise, employers push back, and members would leave the network. So to counterbalance the leverage that hospitals have, insurance companies build large networks and memberships to negotiate prices downward. So when you have health insurance, you pay less than the prices the hospitals and doctors would otherwise charge. But without health insurance, you're on your own and you have a lot less leverage when it comes to negotiating what you pay. So you usually end up paying more than you would have had you had health insurance. Another reason to get health insurance has to do with bankruptcy. Medical debt is responsible for over half of bankruptcies. And it's important to remember that hospitals are businesses. Yes, they're businesses that do good for their communities, but they're businesses nonetheless, which means if you don't pay them, they can go after you. And one of the ways they can do this is through debt collection agencies if your debt is over 90 days old. And if you hold on to that debt for longer than a year, then they can report it to the credit bureaus, which can negatively impact your credit scores. Now, we just discussed how prices are usually higher when you don't have health insurance, which leaves you more vulnerable to medical bills in case something does happen to you. And that also makes you more vulnerable to declaring bankruptcy if you can't pay, as that's one of the few recourses you have to avoid paying your medical debt. And that too can negatively impact your credit score and savings. Speaking of high medical bills, one of the easiest ways to incur this is if something catastrophic happens to you, like a cancer diagnosis or a car accident. Now, I know we usually don't like to think of these things as things that can happen to us, and they are rare for young, healthy people, but they are possible. And if they do happen, they can be financially devastating if you don't have health insurance. Most doctor's appointments look like this. One appointment, maybe one prescription, and maybe a follow-up visit. The bills are relatively small and manageable. Now imagine something catastrophic happens and a bunch of beans spill everywhere. This is what medical bills can look like if you encounter a major medical event. The bills can be hundreds, thousands, even tens of thousands of dollars. And the problem is you can't predict which pile you'll be in. You can eat healthy, you can exercise, you can sleep well, but you still don't know which pile you'll end up in. And that's what makes health insurance important, because it can make care affordable in case you end up in this larger pile. I bet you heard of stories of people who had something small bothering them, but they went to the doctor's office to get it checked out anyways, and it turned out to be something more serious. But because they caught it early, the treatment was less invasive and the success rate was higher than it would have been had they caught it later. Well, that's exactly what preventative care is for. Screenings, vaccines, routine checkups are there to help prevent or detect medical issues early. And if you buy health insurance on the ACA marketplace, those plans cover certain preventative services at no additional cost to you outside of your monthly premium, meaning no copays or coinsurance. However, if you don't have health insurance, you'll pay for these out of pocket, or even worse, delay care until you get sick, and then the problem is both more expensive to treat and worse for your health. I hope this video helped you understand why health insurance is better than no insurance. And if you need help selecting which type of plan is right for you, check out one of these videos here. Thank you so much, and I'll see you in the next one.